Over the past decades, medicine has made enormous progress in all areas. New innovations are regularly launched on the market, for example, in the fields of diagnostics, surgical techniques, and of course, drugs. So there are good reasons to hope that diseases and ailments will soon be a thing of the past, because modern medicine seems to have the right answer to every problem. However, studies dealing with the actual prevalence of diseases show the complete opposite. Patients with chronic diseases are not decreasing. Their number has been increasing massively for years. This is a video by Dr. Tao, and in this video I will show you how you can improve your quality of life and prevent chronic diseases by fasting at intervals, or as we call it, a 16-8 diet. In 2013, only 1 in 20 people worldwide had no health problems. In contrast, 1/3 of the world's working-age population already had 5 diagnoses at the same time. Some chronic diseases have risen particularly sharp. Arthrosis, for example, increased by 75% between 1990 and 2013. Diabetes mellitus by 135%. Alzheimer's dementia by 92%, and medication-induced headache by a whopping 120%. A simple answer is often used to explain this enormous surge in chronic conditions. Improved hygienic conditions, less wars, and extensive medical care are all helping people to get older. And those who get older also have more time to develop diseases. But it is not that simple. Increased life expectancy is not the only explanation for the increase in chronic diseases. Getting older does not necessarily mean getting sicker. In addition, as we have just heard, chronic illnesses are very widespread among people of working age. So what are the real reasons why we are increasingly ailing? The answer to this question is amazingly simple. Our modern, not species-appropriate way of life. Our diet and our lack of exercise are the 2 key factors. Large-scale studies have undoubtedly shown that overweight and poor nutrition are by far the most important risk factors for the development of chronic diseases. In Germany, 62%, and in the US, even 68% of the population are overweight. Tendency further rising. Directly on rank 2 of the risk factors and closely associated with obesity is the lack of exercise. 29% of Germans over the age of 15 are absolutely lacking in exercise. In the age group over 55-year-olds, even 2/3 of the population do not exercise at all. And even children and teenagers freeze in front of their phone and computer screens today. Of the 4 to 17-year-olds, an alarming 85% suffer from a lack of exercise. The 4 largest groups of common diseases are closely related to obesity and lack of exercise. Diseases of the musculoskeletal system. If only 5 kilo overweight increases the risk of osteoarthritis in the knees by 30%, what damage do we do to our back and joints if we carry around 15 or even 20 kilo or more of overweight every day? That is the equivalent of carrying a heavy suitcase all day long. No wonder then that 31 million Americans suffer from low back pain at any given time. Cardiovascular diseases. Here, there's a one-to-one relationship between high blood pressure and obesity. 10 kilo too much on the scale mean an increase in blood pressure of 10 millimeters of mercury column. Metabolic diseases such as type 2 diabetes are 100% due to overweight and lack of exercise. Recent studies have shown that if you adhere to the 16-8 diet and start to exercise regularly, again, type 2 diabetes is in fact reversible, all without medication. Even cancer shows an alarmingly close connection to overweight and lack of exercise. The risk of developing cancer of the uterus increases by 62%. For gallbladder cancer, the increase is 31%. For kidney cancer, 25%, and so on. So, if it is clear that wrong eating habits and lack of exercise make us increasingly ill, it is also self-evident what needs to be done. Start moving again. Children and teenagers should exercise for at least 1 hour a day. Adults need at least 2 hours of physical activity per week. And that's not really much, isn't it? And of course, you can always do more. Once we are back on track, our natural instinct to move reawakens. The positive effects are enormous. Problems of the musculoskeletal system often disappear completely. Risks of cardiovascular diseases drop dramatically. Our metabolism improves noticeably, which is especially evident in the nervous system, with better concentration and performance and an antidepressive effect. The risk for cancer is also greatly reduced. And as if all that were not enough, sufficient exercise also improves our overall well-being and quality of life and makes us live longer too. Besides sufficient exercise, our dietary habits play the most important role for our health. It is important what and how much we eat, but even more important when we eat, or more precisely, when we don't. Through the millennia of human evolution, one of our biggest problems has always been the next meal. In other words, food was always scarce. So, when there was nothing to eat, we were forced to fast temporarily, which our organisms have perfectly adapted to during the course of evolution. What our system can't cope with, however, is eating 3 meals a day, plus coffee and cake in the afternoon, and possibly a snack in between. Today's uninterrupted supply of food leads to a complete overloading of the body, and that in turn opens the door for chronic illnesses. Since we are so wonderfully adapted to short-term fasting, because we have learned so over thousands of years, we simply have to remember this and return to eat a diet that is human species appropriate, meaning an intelligent and moderate diet. The 16-8 diet, also known as intermittent fasting, is not a new nutrition hype, but the only species-appropriate diet for us humans. 16-8 means that we may eat during 8 hours a day and for the remaining 16 hours do not consume any calories. These 8 hours can be a breakfast and a lunch and a snack in the afternoon. From 3 p.m. until the next morning at 7 a.m. we stop eating. Or we may also eat from 10 in the morning until 6 in the evening, but between 6 in the evening and the next morning at 10, no more calories will be consumed. You can drink as much as you want during the 16-hour calorie pause, meaning water, tea, or coffee. Of course, without milk or sugar. If 16 hours seem a lot, only remember that you sleep most of the time anyway. What occurs during these 16 hours in which we do not supply calories is really a small miracle. Each of our many trillion cells does not just magically clean itself, it also repairs itself during this time. Imagine your cell being a big kitchen in which people cook and sizzle all day long. If all the supplies and wastes are just left there, mountains of rubbish will soon pile up, smelling awful and attracting pests. And this is exactly what happens in our cells. If we constantly clog and overload them with food and snacks and do not give them a break to initiate their ingenious self-cleaning program. Like every factory and every kitchen, our cell metabolism continuously produces waste products. They cannot be broken down as long as the cells are constantly supplied with nutrients from outside. This process is interrupted by the 16-8 diet, and our body's own detox program is started, which not only removes the cell waste, but even recycles it. This process is called autophagy. In autophagy, the waste products of the cell metabolism are enclosed in a thin membrane, in other words, packed in small garbage bags. These special garbage bags are then filled with acids and enzymes that break down the contents and recycle them. Once the cleaning program is complete, the recycled materials can be reused, for example, as fuel for the cell or as building blocks for proteins. So, we have learned regaining your health or staying healthy is not that difficult. Sufficient and regular exercise plus 16-hour meal breaks is my simple formula. And then, not disease, but health will loom. What are your experiences with intermittent fasting? Please comment on this page. And if you enjoyed this video, please like it and subscribe to my channel. Thanks for watching.